Hi, I'm Jarvis Odgers, physical therapist and clinic director at Rebound Physical Therapy. Rebound is an outpatient physical therapy practice dedicated to helping people get back to the lifestyle and activity that they know and enjoy. Today I'm going to talk to you about a physical therapy evaluation. First, let's kind of define what a physical therapist is. In my mind, we are movement specialists. We are highly trained to analyze and assess how the human body moves and functions. A lot of times people ask when they should get a physical therapy evaluation or what that entails. And I think oftentimes people think you have a physical therapy evaluation after surgery or after an accident or injury. And while that is certainly true, we tend to treat a whole host of other ailments, ranging from dizziness or inner ear vertigo symptoms, pelvic health issues such as bowel or bladder issues, strength and balance deficits, and a whole host of neurological conditions such as Parkinson's disorder or multiple sclerosis, just to name a few. Now, when you come into our clinic for an evaluation, the first step is going to be filling out paperwork. This gives you an opportunity to kind of get us up to speed on your previous medical history and really kind of outline what you are here to be treated for and hopefully set some goals and expectations of what you hope to get out of physical therapy. Once the intake paperwork is completed and reviewed by a physical therapist, we'll bring you back to one of our treatment areas, and then we sit down for kind of an interview, what I like to call the 20 questions portion, where we really get to sit there and ask you different things, really get to know you as a person, know what you're dealing with, and again, get an idea of what you want to get out of physical therapy, what your goals are. We'll ask questions kind of pertaining to what your daily life looks like, what your responsibilities are, what your activities are, even what your home looks like. I mean, getting the idea of, do you have to go up and down stairs? Are you a caregiver for someone? Those sorts of things. After we are done with the interview portion, we tend to move on to a movement assessment, asking you to do various tasks and activities. You know, looking at the way you walk, looking at the way you bend or get out of a chair, for instance, and this can range all the way up to how somebody runs, jumps, throws a ball. From there, we typically will move on to the objective portion of it, where we're putting hands on the patient, getting an idea of how a joint moves or how strong a muscle is. A lot of times performing some special tests, which helps us get a better understanding of what's going on with that joint or body part that we are going to be treating. Once all of that data has been collected, then we get to sit down and have a conversation with you. The goal of every evaluation is to walk away with kind of a therapy diagnosis. Really, the patient should have a good understanding of what's going on with them, not only what's going on with them, but what we can do both in clinic, but what they can work on at home to address those issues or deficits. It's one of those that after an evaluation, you should walk away with at least a couple of tools to start working on at home to manage what you're going through. So if you're sitting at home and you're watching this and you're dealing with something that maybe it's a pain issue, maybe it's a strength issue, or maybe it's just one where you've noticed that your function is not where it used to be, please give us a call. We'd like to meet you, and we'd like to get you in for an evaluation today.